I'm Kathy Edge, and today is May 6, 2021. I've been a volunteer with Providence Hospice in Oregon for 3 or 4 years now.
My name's Stacie. I am a nurse with Providence Hospice, where I have the clinical community liaison role, where I provide support in long-term care communities, facilities. As Kathy said, it's May 6th, and I am looking forward to this conversation.
I want to start by inviting Stacie to tell us a little bit about what her job actually is.
A great question. I've been a registered nurse for over 30 years with Providence, and when this job was created about 5 years ago, hospice saw a need as we partner with these different long-term care communities, the different assisted livings and nursing homes and memory cares. How do we partner better with them? How do we honor the journey that they take with their residents and where we come alongside them? These long-term care communities take care of their residents 24/7. There's an inherent complexity. You have the patient that wants their own autonomy, and then you have the family of the resident, and they want to also give input. And then you have the facility. They feel like that is their resident. It is their patient. They're the ones logging in the 24/7 care and support. And then you have hospice coming alongside to provide support. So there's an inherent complexity there. It is possible that everyone takes separate corners and could potentially duke it out of who gets authority. It's complex, but when it works well, which it most of the time does, it is a beautiful dance and allows people to finish their lives well.
I had not actually thought about that before meeting you. My work has been more with patients primarily in a home setting. I've experienced some of what you're describing of there being multiple cooks in the kitchen with the patient, the family, and hospice, where each of those individuals can come with different views.
Hospice not only wants to support the patient and their family and friends, but these long-term care providers, whether it's the bedside care providers or the nurses in a facility or the administrators, sometimes the maintenance person has an incredibly close relationship with the resident. We want to make sure that they feel supported because they have a uniquely privileged and challenging role, especially during a pandemic. So yes, when it works well, it is a beautiful dance. Not always orchestrated. We might need to fly by the seat of our pants sometimes and be creative, but yeah, it's beautiful.
Some improvisation.
Yes, some improv, you got it. It's really about listening. It's about connecting with either our staff, which I do a lot of listening from our staff, gathering information about what's going well and what's not in the relationship, and the facility staff. If I listen well, then I hear what the concerns are. And sometimes it's just, go ahead.
Think of an example where listening helped a naughty situation.
Sure. We had just a very sweet community. Their bedside staff member was very concerned that our staff member did not address the patient's pain, did not give medicine to provide pain relief. And that just did not seem to be likely that our staff member would have done that. What it turns out, it's almost comical. Our chaplain came into the community and introduced themselves as a chaplain. And by the time they finally got to the bedside caregiver they were talking to, multiple introductions later, somehow that bedside person did not hear that they were a chaplain. The chaplain's role is spiritual support. Do they sense whether the patient has pain? Absolutely. Are they allowed to give medicines? Absolutely not. This bedside staff member is like, your staff member didn't even give the suppository I asked them to. Now, no offense, a chaplain does not do suppositories. Might be a more blessed experience if they did, but they are not allowed. It was just that communication, right? But I was able to have a conversation with the bedside staff member once. I asked if I could speak to that specific person. And I said, oh, so it sounds like the introduction was missed somewhere in there. I said, but what it sounds like you're saying is that pain and comfort is really important to you in the care of your resident. So I just want to assure you that that staff member, I looked in the chart, they did bring it to the attention of the nurse, and your concern was taken into consideration. So I didn't make the person feel stupid, like, oh, it was a chaplain, why did I ask? Acknowledge the fact that they were really concerned about the resident. And we've had multiple miscommunications.
I love that story. I love that you not only identified that very simple miscommunication and addressed that, but you went beyond that. And I hear you describing really listening to and honoring the values of that bedside caregiver.
And I think when we all get stressed, and I have to say the pandemic has added an extra layer of stress, that it is easy to not assume positive intent, that you just think, well, that person's, not on my side and, be adversarial. Now, it's possible that at times we don't have positive intent, right? That we're fallible people. And there are times where I do clean up on aisle 4 and I try to mend relationships, but most of the time it's miscommunication.